So we will get started. I'd like to welcome Dr. St. Joy. Before I tell you a little about Dr. St. Joy, I want to acknowledge some people who this event could never have happened without. Assistant Director Juelle Daley. Juelle Daley, please say hi.
Hi,
All
everybody.
right. Thank you. I'd also like to thank Farad Berry, Jessica Williams, and Jennifer Owumiki. Thanks to Lori Pierce, Angie Moody, and Deborah Holt of UNC TV. Thanks to the Dean's Office at DePaul, including Dean Guillermo Vasquez de Velasco, Molly Bench, Susana Pagliaro, and Associate Dean Dr. Jacqueline Lazou. Very quickly, this will be a half-an-hour event. Dr. St. Joy has quite a bit to do. And so we are going to, Dr. St. John will talk a little, give a presentation. It'll be followed by a question and answer session. Juelle Daley will lead this. Please send in the chat, send your questions, and then she will pose the question to Dr. St. John. All right, and then the event ends at 3 o'clock Central Standard Time. A little about Dr. St. John. Thank you so much for taking time out of your busy schedule. Dr. St. John is the Executive Director of CARPHA, Caribbean Public Health Agency, since July 2019. And the Executive Director provides leadership and direction to CARPHA in executing the functions laid out in the Intergovernmental Agreement. She was the Assistant Director General of the World Health Organization from October 2017 to 2019, with direct responsibility to the World Health Organization for Climate and Other Determinants of Health, the first Barbadian to be Assistant Director General. She's the former Chief Medical Officer of Barbados, the first Barbadian to hold that office for over 12 years, top public health advisor to the Minister of Health, and then responsible for the oversight of the management of the health sector. And she was also the chairman of the executive board of the World Health Organization from 2012 to 2013. Dr. St. John, thank you so much for being here.
Thank you very much. And I think I should just start to share my screen so we can get the presentation going. So, can you see my presentation?
Yes, I can see it.
Wonderful. So, I'm going to tell you a little bit about CARPHA and what we do and who we serve, and then go into the impacts of the COVID-19 in the region. Are you enjoying that calming picture of the sea? That's what the Caribbean Sea looks like. Then we'll talk about CARPHA's role in this whole COVID-19 in the CARICOM region. We'll give you some regional data, and then we'll go into conclusions. So first about CARPHA. CARPHA is the amalgamation of 5 regional health institutions: the Caribbean Environmental Health Institute, the Caribbean Epidemiology Center, and the Caribbean Food and Nutrition Institute. Those last 2 were PAHO institutions. And also the Caribbean Health Research Council and Caribbean Regional Drug Testing Laboratory. So CARPHA has a huge remit, unusual among public health agencies. Usually it's only just about epidemiology, like Centers for Disease Control, but we have other remits: food and nutrition, research, drug testing, and drug regulation, so that we ensure the quality of what is coming into the region and check on the quality of what is there, and if there are adverse drug events, we report to regional and global systems through VigiCarib. And of course, the Environmental Health and Sustainable Development Department. Make sure that we keep on top of the environmental health and environmental management. So it's one of 3 multinational public health institutions globally, and it was established in July 2011, but did not get started until January 2013. The headquarters is in Trinidad, but in St. Lucia is our environmental health department, and in Jamaica is our medicines quality control and surveillance department. So the vision is healthy people, healthy spaces, healthy Caribbean. And these are the countries that we serve. You will see that we also have UK overseas territories. We have Belize, which is Spanish speaking, and we have Haiti, which is French speaking. So we've got some really interesting groupings, as well as some very unique territories. Most of the territories are small island developing states, but we do have land masses with coastal borders as well. So what do we provide? Strategic direction in analyzing, defining, and responding to public health authorities, promote and develop measures for the prevention of disease. One of these would be non-communicable diseases, and that's important because of how it affects COVID-19, the response to public health emergencies, and of course, supporting relevant objectives of the Caribbean Cooperation of Health in Health, which is functional cooperation in our CARICOM space. So what are the numbers at a glance? For the Caribbean region, which also includes countries that are outside of the CARICOM space, at the point that this presentation was made, there have been 11,990 cases with 530 deaths, but 2,763 people recovered. And then on the right, you can see the cumulative total confirmed and recovered cases. So for CARFA member states, as of May 1st, there have been 1,412 cases confirmed, the highest number reported on April 15th, which is interesting. So that means that we've been having fewer cases of late. And this gives you an idea of the PAHO cumulative suspected and confirmed COVID-19 cases. Of interest should be the transmission type. So this covers all of the Caribbean, which includes countries that are not under CARFA's jurisdiction, but most countries have claimed sporadic cases or clusters of cases. Just yesterday, Barbados has indicated that they have community transmission, which means that the epidemic is running on Barbados steam and not the importation of cases. And we also give you an idea of those that have recovered. Moving on, what are the vulnerable groups? So as we were chatting before this program started, we look at people not in terms so much as color or ethnicity, but in the categorization of having non-communicable diseases or not. And what we have seen is that adults over 60 years, rather than what was being said originally, adults over 80 years have been affected. But adults under 60 with non-communicable diseases are also contracting COVID-19. And the risk factors include also smokers, although prevalence usually is lower in the Caribbean, and obesity, and we've got quite a bit of that. So our vulnerable groups are defined in this way. So what actually has been happening? So what you're seeing is the daily surveillance, courtesy of the University of the West Indies. They've been tracking the cases as reported by PAHO WHO. And you're looking at graphs that have a dark bar in the center. This is of the average of all the Caribbean. What you've seen here is dotted lines representing the actual cases superimposed on percentiles of cases. And so there are some countries, let's have a look at Guyana. Guyana closely follows what the average is in the Caribbean. But you've got some countries that have been below average. Look at Anguilla, bottom left. It's been practically flat, no cases at all. But then look at Barbados, top right. Barbados is well above the average set of cases for the whole of the Caribbean. And this would suggest that there is going into community transmission, and they have actually declared community transmission yesterday. But you will also see that there's been a tapering off of the curve. So if you look at all of them, even if they had a moment of going above the regional average, they've all tended to have plateauing. So these are a function of the public health measures, the testing, contact tracing, quarantining, isolation, and then on top of that, the measures for suppression of disease transmission. What is commonly called in the Caribbean is the lockdown. So the lockdown combined with the public health measures have for the most part really curtailed and blunted that epidemic curve. Now we have one anomaly, which is Jamaica. Jamaica had the whole issue of a call center. Younger people and conditions have allowed a cluster of cases, a significant cluster of cases that have shot up their cases, and also has changed the epidemiological profile from an older profile to a younger profile. So these are what's happening just as countries started to open up, because some countries started to relax those suppression measures. So what the University of the West Indies is going to be doing is tracking on a weekly basis so we can see if there's any change in the trajectory of the epidemic curve now that the lockdown is being opened up. So what has been CARFA's role in the whole COVID-19 response? And CARFA is part of the security cluster of CARICOM. And we've really managed this as a health security issue. We've tried to have coordination of the public health response with provision of advice to non-health sectors, because CARFA cannot command non-health, but we can advise them on things that they can do. There's been risk communication with a communication policy produced, and of course, resource mobilization efforts. The European Union has been very generous in giving an €8+ million injection to CARFA for looking and working at the health aspects of this COVID-19 outbreak. So when this whole thing started in January, we actually started working with the chief medical officers January 4th, because one of my class, undergraduate medicine class members, lives in the region, and he was telling us, we have a WhatsApp group, he was telling us of some of the things he was seeing. And I took notice because it was different. And then lo and behold, it was declared a novel virus. So we started working. At that time, we assessed the Caribbean as having minimal risk. We used the security cluster to track persons who were coming into the region. And we realized that because of the screening measures that were in place, both in China and through most of our feeder airports, that it was minimal risk. Then the risk became low, moderate to high, and then we went to very high just before we had our first case in Jamaica, March 10th. So these measures that you see here were in place to try to control what was coming in, to try to strengthen countries' ability to detect, to prepare other sectors as to what they must do to minimize importation and transmission. And this also gives a timeline. So you can see that we actually started working in November, not for COVID. We were working for epidemics. And when I say we, I'm talking about the security cluster. We put epidemics in tier 3 of the 4-tier risk and assessments profile for the region. And so when we realized that we had an epidemic, we started managing this through the security cluster. So a lot of what we did was through CDEMA, because CDEMA, the Caribbean Disaster Management Agency, can command other sectors. RSS, the Regional Security System, we use that to bring samples, especially now that we don't have flights and borders are closed. They've been bringing samples to CARFA for the countries that don't have their own capacity. And also JRCC for tracking persons coming into the region for countries of concern. And then we started producing guidance. And you will see that in every other day, 3 times a week, we do situation reports. That WhatsApp group with the CMOs, we're constantly chatting with them about what's happening. They use it to also compare notes about what each other is experiencing. And we've produced guidance. You will see interim guidance for ports of entry. You will also see our situation report. It's become less wordy and more infographic based. And of course, we've been giving technical advice to regional governance bodies, both health and the Conference of Heads of Government and technical leads at national level. So what are the challenges that remain? So procurement of essential resources. Because we're small, they don't take us on. We don't generate enough requests to be warranted. And we've been having serious issues with procurement of essential things, even having some things seized by certain countries. Test kits, PPE, ventilators, surveillance data. You cannot manage an outbreak like this without knowing what is going on at the national and subnational level. And then we have issues with incomplete data at the regional level for monitoring and evaluation of measures. The economic shocks, it's a global issue, but tourism slowed. Service industry had to reset. And of course, coordination with multiple sectors is never an easy thing. So the heads of government, as wise leaders should, have decided that regional solidarity has to remain the way in which we manage this first wave and come out of the first wave. So there's also been the mandate given to produce a common public health policy and protocol, with interregional travel protocols being the first focus. And of course, joint procurement of medication, supplies, and equipment through both PAHO and WHO. And of course, we're looking at food security. A lot of us import everything. This is a picture of the CARICOM Secretariat in Guyana. So how are we going to get out of this? What's the future of the Caribbean in COVID times? You will see that lovely yellow brick road. It's the WHO yellow brick road. 6 measures that are recommended to countries so that they're able to come out of the first wave safely while ensuring that there's detection of illness, the control of spikes. So it's going to be necessary for us to develop a set of Caribbean exit strategy indicators. What are the epidemiological indicators? What is the economic health? What is the population health? And because we're so tourism dependent, what are the measures that we can put in place? First, for interregional tourism, so we don't have spikes in cases. And then, of course, that means the coordination of key sectors around this health. Because even with tourism, our tourists go everywhere. So we have to make sure that we have protocols in place that ensure good health. So those purpose-built protocols to live with COVID-19 until we have access to the vaccine, whenever it's produced. We have to learn how to live with COVID-19. And that, for me, this is my concept, means that we also have to look to how we can make this both a green economy and a blue economy. The new ways of living and the new innovation in how we live. So thank you very much. That is my presentation.
So thank you. I want to follow up real quickly with what you mean in terms of a green and blue economy.
So green means just that. We have to understand what are the drivers of climate change and change those drivers. A lot of the member states had gone for certain things like banning single-use plastics. I had a climate change and health initiative when I was at WHO. So the small island developing states had actually defined measures that they wanted to put in place so that climate change and health were no longer seen as separate issues. What were the things that the health sector itself could do, greening and making buildings safe so that they were not affected by severe weather events, the use of plastics or the use of fuels that were not good for the economy, and then other measures, including at the national level, having the use of alternate sources. The sun can do so much more than it was than just keeping us warm. So that's green. Blue is this whole issue of innovation, bringing younger entrepreneurs into the money-making sector. And know that we have to change the way we live, change the way we celebrate life, because in the Caribbean, we celebrate life by liming together, eating together, lots of hugging and all of that. COVID loves to spread just that way. So we have to find different ways of doing things. Curbside for eating. Instead of actual get-togethers, you have virtual get-togethers, meetings, the ways in which we will work, the social distancing in the workplace. When we've opened up the beaches, we've encouraged people to social distance still. So what are the economies, what are the new innovations around that new way of living?
Mm-hmm. So why don't I open up to the chat? I have a bunch of more questions, but I want to open it up to participants who might have questions. Juelle?
I have a question that I wanted to ask, and it's one of the things that I feel is very interesting about the Caribbean prior to COVID. So the thing is, how do you, in an economy wherein hospital infrastructure was never, in some nations, not necessarily going at their A+, how are Caribbean governments amping up their hospital infrastructure in the event that the spread of COVID becomes unmanageable?
Okay. So you're talking about how is the health sector managing COVID-19 clinically? So for the first part.
And in terms of like bolstering their capacity with the possibility of a surge of.
Okay, so I'll tell you. So the first thing they decided is that they're going to try to keep their regular hospital work and well, you're talking hospital, we're very much hospital and primary health care, preventive medicine. So there was a look at how you can keep the two systems going in parallel. So you don't have COVID coming into your regular health system because of the huge burden we have with chronic diseases. So what some countries did is that they retrofitted, and some people actually built in a month facilities that were just for COVID-19. And so you had a space ramping up. And then of course we tried to buy the supplies, etc. But in terms of human resources, because remember the issue with COVID is not the mild and moderate disease, which is 80% of all of the cases. It is the 20%, 15% severe and 5% critical where there's most of the loss of life. So and those require specialized doctors, nurses, critical care, and that sort of thing. So a lot of the Caribbean countries turned to Cuba because we all got importations all at the same time. So we couldn't help each other. Mm-hmm. So we turned to Cuba and special arrangements were made, including the registration of these professionals. Special arrangements were made to allow them to come in and integrate into the society and the healthcare. In terms of the treatment, because there's no prescribed treatment, but the treatments under trial are treatments that are in our systems already for other diseases, HIV, lupus, etc. So there's also been that whole look, and CARFA helped with this as well, that whole look of how you can apportion medication so you keep the people who were using it before on it, but also apportion it for those who are hospitalized. And we're doing this, and we're working with WHO on the Solidarity Clinical Trial. So that's the ramping up of facilities, the ramping up of supplies and equipment, the human resources, and the medication.
Gotcha. Okay. Thank you for that. There's another person here who wants to ask the question, and it's from Kate Barrett. She says, "Can we ask questions?" She says, "I'm curious about the situation in Haiti. I'm aware that that we have been deporting COVID positive Haitians back to Haiti. I'm also aware that some people don't believe that COVID is a real thing. Can you speak to the situation in Haiti? And also the numbers in the Dominican Republic look so much higher than other Caribbean countries. What are your thoughts on why that is?"
So in terms of Haiti, although Haiti is one of our countries, Haiti was given its own testing capacity by PAHO. So I don't know very much about their numbers or how their testing is carried out. But in terms of some people not thinking that COVID is a real thing, that's not just a Haitian issue. That's unfortunately found in some very knowledgeable countries as well. But the whole understanding of it not being just a flu is really coming into the fore in the Caribbean. People understand this. They've been tracking what's happening in their countries in terms of illness and death. So people are understanding this is serious. Dominican Republic is not one of the countries in our jurisdiction. Mm-hmm. And I'm not quite sure why they have had such high numbers as compared to the Caribbean. Maybe there were some issues with either the public health measures or the lockdown or suppression measures. We aren't clear. As a region, we sort of all did the same thing at the same time. We were giving guidance and people were following, coming together, the chief medical officers comparing notes. That probably made us understand things in the same way, but I'm not sure what happened in Dominican Republic.
Okay, sure.
So I think we are out of time. It is 3 o'clock, and I do want to honor Dr. St. Joy's time.
It's 4 o'clock in
that's right, in Barbados. Yes, so I'd like to thank you and thank everybody, because I know people were tuning in from UK, Central America, Caribbean, and the United States. So thanks so much for participating.